What would an app look like that provides on-demand support to pregnant and postpartum folks by connecting them with doulas, midwives, and nurses? That is what you will learn today in this great interview with Simmone Taitt, CEO and founder of Poppy Seed Health. And this episode is being brought to you by Ellement Prenatal Supplements. Welcome to the All About Pregnancy and Birth podcast. I'm Dr. Nicole Calloway Rankins, a board-certified OBGYN who's been in practice for nearly 15 years. I've had the privilege of helping over 1,000 babies into this world, and I'm here to help you be calm, confident, and empowered to have a beautiful pregnancy and birth. Quick note, this podcast is for educational purposes only and is not a substitute for medical advice. Check out the full disclaimer at drnicolerankins.com/disclaimer. Now let's get to it. Hey, real quick, before we get into this episode, my new and improved online birth course, the Birth with Power Pathway, is coming in May. If you want to feel calm, confident, and actually prepared for your hospital birth, this is for you. The best way to be the first to know when it drops, join my email list at drnicolerankins.com/email. Hello there. Welcome to another episode of the podcast. This is episode number 167. I am so glad that you are spending some of your time with me today. Technology is going to increasingly become part of the way we live and the way we care for ourselves, both physically and emotionally. We know that smartphones are here to stay, and it is really important to figure out how to use that technology to our advantage and to our benefit. And that is why I am so excited today to chat with Simmone Taitt. Simmone Taitt is the CEO and founder of Poppy Seed Health, a telehealth app that is transforming the way we care for pregnant and postpartum people by giving 24/7 text access to doulas, midwives, and nurses. Poppy Seed Health is on a mission to democratize accessibility, emotional support, and well-being for all birthing people. And Taitt comes to this work through her highly personal experience of navigating her own pregnancy loss in an inequitable medical system. She is a deep believer that technology can and should leverage its power to connect us all with radical empathy. Her work has been covered by Fast Company, Vogue, Insider. She's even been on CBS Mornings chatting with Gayle King and more. So in this conversation, you're going to learn about her very personal experience with a miscarriage that led her to start Poppy Seed Health. We'll learn exactly how the Poppy Seed Health app works, why she specifically offered connecting with doulas, nurses, and midwives and not physicians. Also, how texting in particular is a great form for support. How she incorporates equity into the app, meaning how they structure the app so that people who want to help others can do so. And they also make sure people who don't have resources can have access to the app. And then so much more in our conversation today. I know that you are going to enjoy it. She is super fired up and passionate about this work. You're going to love it. Now, before we get into the episode, let me talk for a moment about prenatal vitamins and supplements. All of us OBGYNs recommend prenatal vitamins. In fact, ideally, you should start them 3 months before pregnancy. But it can be so crazy confusing to figure out which one to take, which product is right for you. And that's why I was so really excited to learn about this week's podcast episode sponsor, Ellement. They have created the first ever personalized prenatal supplement that takes all of the stress out of the process of trying to figure out which supplement is right for you. Ellement is a twice daily packet. It was designed by maternal fetal medicine specialist, and it is customized not only for each person, but it also changes over time depending on where you are in your pregnancy journey, from preconception all the way to postpartum. Every pregnancy is unique and your prenatal should be too. So visit helloelement.com. That's Ellement with 2 L's. So HELLO ELLEMENT.com and join their waitlist today. All right, let's get into the conversation with Simmone Taitt. Thank you so much, Simmone, for agreeing to come onto the podcast. I'm so excited to talk about you and your story and poppy seed health.
Thanks so much for having me, Dr. Nicole. I am so excited to be here and am also ready to talk about all things poppy and about my story.
Yeah, so why don't you tell us a bit about yourself and your work?
Oh, sure. Well, I'm the founder and CEO of Poppy Seed Health, which I started because of my own experience that has been a very complicated one on my journey to parenthood.
Mm-hmm.
But it started with my first pregnancy loss, which was in 2016 when I went in during my first trimester. It was my second visit, and unfortunately, we couldn't find a heartbeat, which does happen. And unfortunately, it's more common than people think. But it was for me the first time that I had been pregnant, and so I was not expecting to, walk into that appointment and then out of that appointment not pregnant.
Sure.
But in those moments when we couldn't find a heartbeat, instead of getting the kind of care and comfort that I expected, my OBGYN looked at me and told me that my body had terminated the pregnancy, which was just a dagger through the heart and also got me to thinking that something was wrong with me. And then she said, but it's fine. It's normal. It happens. And I'll see you again in a few months when you start trying again. And she left the room.
Oh my gosh.
I know.
That's terrible.
It's awful. As a matter of fact, sometimes I think when we're in these moments when we think that we'll have one reaction, but we're having another reaction. And so for me, I thought the reaction that I was going to have, which I was very emotional and I was crying and, really deeply upset, but I was also in shock because when she left the room, there wasn't any bedside manner to say, why don't you get dressed and, let's talk about what's next for you. Of all the things that I thought would happen, even though, again, I had no baseline, but I did know that when she left the room, I was sitting there, I was crying. And then I was also like, well, what's going to happen next? Like, what happens now? And so I got dressed, I left the examination room, and, she wasn't there. So on my way through the reception, I said, is there anything else that I need? And they looked at me kind of like they had no clue what had just happened, right? But just, as pleasant staff does in a doctor's office, they said, no, we'll see you on your next visit. And that was it. And so I left that office and that appointment with no medical follow-up, no mental or emotional health resources. And I want you to imagine the very busy streets of New York first thing in the morning on a working day, on a weekday. And I was standing outside of that office. I was emotionally distraught. I was also starting to think about what my body was going to do and whether or not I should go into work, which is one of the hardest things for so many women who go through pregnancy loss, because so many of us haven't told our employer so early in the pregnancy, which, in first trimester, it really is about 80% of all losses will happen during that first trimester. But we have been culturally taught not to tell anyone. So I'm standing there considering, is my body, am I going to start bleeding? Like, what's going to happen? Like I see on the movies, on TV, right? Like, what do I do next?
Sure.
And I took to the internet to look for healthcare answers. And I think, in those moments, what I was really looking for it was really some medical direction, because I didn't have it. And it was within just a couple of minutes coincidentally, I found what I was looking for, which was just two very simple things that weren't offered to me. Blood work to show my HCG levels dropping, which is the pregnancy hormone. And sometimes your body and your brain don't always catch up when you've experienced a loss. And in my case, what I later learned was a miscarriage. And then the second thing was just a simple sonogram to show that all of the tissue had passed and that I could have subsequent healthy pregnancies and that my whole health was not in danger, right? And so I picked up the phone. I called my own healthcare plan back into my doctor's office. And instead of feeling relieved and taken care of, I actually felt really enraged and confused and frustrated. And I didn't feel better. I just wasn't feeling better. Mm-hmm. And there was this moment where I decided, so this, by the way, all happened pretty quickly, right? Because I was standing outside on the sidewalk doing all of this Google searching and then calling, my healthcare plan back into my doctor's office. But there was a moment when I actually made the decision to, in fact, go into the office and go into work. And I was also Googling the entire time. And there was a point where I realized that what I was actually looking for was not, what was happening with my body anymore on the medical side. What I was actually looking for was emotional solvency. Mm-hmm. And I found that evening, so same day that evening, I was home on my phone and I happened to stumble onto a doula chat thread. And we know this now. I know this at Poppy Seed Health, and that is most people have no idea what a doula is. Mm-hmm. Doula and a midwife are exactly the same, and they think a nurse just feeds you ice trips in the hospital, right? So
yes.
We know this now from all the surveys. So I was one of those people who didn't really understand conceptually that there are trained people who specifically focus on emotional well-being,
right?
On being your, best friend across the full spectrum of wherever you are in your reproductive health. But like very specifically, doulas, most people know doulas for birth support. And as I was reading through this thread, it was another person who had experienced the loss, but it was such a powerful digital experience for me because it was the first time all day that I felt seen, I felt heard. Right. I didn't feel so isolated. I was in such a dark place. And it was so powerful that I made two decisions that evening. The first one was to become a doula myself, which I did, and I am. And the second one was the idea for Poppy Seed Health, which, very simply for me meant that I shouldn't have spent the last, 12 hours looking for something for emotional and well-being and mental health support that I could have gotten on demand, like we get our groceries and we get our wardrobe to the front door, right? To really be able to immediately get into a trusted conversation with someone who could support me and also give me those tips and tricks, which I'm sure we'll talk about. But very simply, Poppy Seed Health was really born out of my own need. And then also the need of millions of other people who are going through, starting their family, their pregnancy, their postpartum journey, and also their loss journeys.
Absolutely. Well, first off, I'm mortified that happened to you and that was your experience with having a miscarriage, because that's really unacceptable.
Thank you.
But it's great that you were able to, it seems like almost immediately find a bigger calling from a difficult experience, like in the same day. You experience so much and then actually followed through with it. So that's really, really admirable.
Thank you. I have been accused of a lot of things, but being not being a go-getter isn't one of them. I will tell
obviously
that actually my entire career has been in building tech startups. And,
okay.
At the very baseline of what that means for so many people who are builders and innovators is that we see a problem and we want to solve it. For me, I lived through trauma, right?
Mm-hmm.
I was trying to solve for myself. And so like very selfishly, I think that the best founders are people who are not just serving themselves and solving for their own lived experiences, but can identify that there is a need so much bigger than who we are.
100%, 100%. Let's talk about something most pregnant women aren't getting enough of, omega-3 DHA. The recommendation is over 200 milligrams a day, but less than 5% of pregnant women in the U.S. meet that. That's one of the reasons I love Ritual's Essential Prenatal. It has 350 milligrams of vegan DHA, plus other key nutrients like methylated folate and choline to support baby's neural tube development. As an OBGYN, I appreciate that Ritual goes beyond the basics. The formula is science-backed, third-party tested for heavy metals and microbes, and every ingredient is traceable. And the delayed release design, it's gentle on the stomach, something that really matters, especially if there's trouble with nausea during pregnancy. You deserve to know exactly what you're putting into your body, especially when it comes to prenatal multivitamins. And with Ritual's dedication to traceable science and sourcing, you always will. See for yourself with 25% off your first month at ritual.com/Dr. Nicole. Start Ritual or add Essential Prenatal to your subscription today. That's ritual.com/Dr. Nicole for 25% off your first month. So have you since gone on to have children yet?
So I don't have children yet. Of course, I get this question all the time, and I'm so happy that you asked me, because it truly is, I think, in parallel to building Poppy Seed Health. When I get asked, do I have children yet? I do not have children yet. I've had multiple pregnancy losses since 2016. I have tried in many different ways to have my own biological children and to be able to carry to term. And that hasn't happened yet. And I'm still on that journey. And so there's so many conversations that we have with people at Poppy, which to be very specific about our experience at Poppy Seed Health, we're text-based. So people are coming, they're downloading the app, and in 90 seconds or less, when they request a chat, they are in a one-on-one, private, secure, trusted conversation with one of our doulas, midwives, or nurses.
Okay.
And we aren't there to give medical advice. We are very much there for your emotional and mental health support. But inevitably, what comes out of that is someone who's like me will come to Poppy and express, frustrations over, let's say, another failed IVF cycle, and have like real feelings and things that they can't say out there, but they can say in here at Poppy Seed Health. And that conversation goes from having those really, heavy feelings of inadequacy, which I've personally felt on this journey, or frustration, using some, choice words in a trusted, secure conversation. And you have someone who knows exactly where to meet you in those ugly places, right?
Gotcha.
And so we have so many of these conversations that I can relate to when I'm reading from just strangers from across the country. So though I don't have my own family yet, I know that with every single person that we're supporting at Poppy Seed Health, I just somehow feel like it's bringing me closer to what my family will look like one day and how
Gotcha.
it will happen.
So, sometimes being around pregnancy things for people who are trying to get pregnant can be awful, but it doesn't sound like that's the case for you, or is it? Or is it a mix?
It's a mix.
Okay.
It's a real mixed bag, right? So on some days, I will say I'm a glass half full person.
Mm-hmm.
I am a real big thinker and optimist, and I believe deeply in the support of community
Mm-hmm.
and in shared lived experiences, even when we're not openly sharing all of it.
Sure.
And there's something about being able to admit that some days I just really don't want to go to the baby shower.
Right.
But then I show up at the baby shower and I'm so inspired, right? And I feel better because I'm there. And there's some days that I, really feel so close to this mission with Poppy Seed Health that I know that every time we bring, we're able to support someone to bring a healthy birthing person and baby earthside,
Mm-hmm.
that there's just something about that magical, but also very real human experience
Right.
that helps me ground myself deeper in my own personal journey, and also is a very personal North Star for Poppy Seed Health, because I do believe very boldly that my own experience, having a mixed bag of feelings, is exactly what so many people are experiencing.
Sure.
We're just not
Sure.
talking about it. We're not saying that openly. And by the way, there's this other, I've been thinking about this lately a lot, because we're getting, not surprising, through the pandemic, there are so many people that did have babies during the
Right.
pandemic and who are newly postpartum. And we've recently been just having a lot of conversations around kind of like socialization, not just for the babies, which is what so many people focus on, but for the parents themselves.
Right. Right. Right.
And it's for me, it's so interesting because I keep saying, like, it's okay. We can't tell people how to feel, but certainly, I will have a baby one day. I will have my family one day, and I'm not going to love being a mother every single day, and that's okay,
Sure.
right?
Absolutely.
And I'm not going to. I'm going to have long, hard nights and days too. And if I can't admit that openly, then what are we all doing,
Gotcha.
right? Like, what are we doing if we can't admit that? So, look, I think the mixed bag of feelings is such a real state of being and a real state of mind for most people. We're just not talking about it.
Gotcha. It is 100%. 100%. Everything you said is completely spot on. And we definitely need to talk about it more. So you said it a little bit, but the way that the app works is that you download it, put it on your phone, and you said within how long you can connect with a doula, nurse, or midwife?
Yeah. So we're available in Apple, in the iOS store, and also on Android, Google Play. It was really important to us that we were inclusive from day one. So
Sure.
making Poppy Seed Health available to everyone. You download the app. Downloading the app is free. And as soon as you download the app, what we hope, because we spent a lot of time on this, is that just the design and entering a digital world that is all your own feels like you belong there. You feel a sense of comfort and care. And that's from the design. So from the user experience to the graphics that we have in Poppy Seed Health, we want you to see yourself there. And then we really focus on three things with the app. The first thing that we focus on is exactly why you probably landed and downloaded Poppy, and that is to chat with one of our doulas, midwives, and nurses. It is all text-based. Believe me, we tried everything else with phone and video. But the truth is, everyone loves texting. It is behavior that we're comfortable with.
Right.
And second to that, I like to call it expert anonymity. Although you know exactly who your advocate is, you see their picture, it's a real person in real time. You learn a little bit more about that advocate while you're in the live chat. But once you request a chat on Poppy, you are in a chat with someone in 90 seconds or less. And the way that I like to describe it for folks is that this is revolutionary in a lot of ways. The first thing is that back in the day, we all used to take, I live in New York, so we all used to take yellow taxi cabs. You go outside, you hail one down. But then with the evolution of car sharing apps, we now get cars conveniently on an app.
Right.
And we get in and out of cars with perfect strangers sometimes every single day.
Right.
And what we trust is the quality of the service. We're not necessarily building the relationship with the driver, if that makes sense, right?
Yep, makes perfect sense.
So when I thought about my own need and like how important it was to be able to leverage just the simple notion of connecting two people who really need each other in those moments. For me, it was taking that concept of trusting poppy seed health and the quality assurance that we have here, but also knowing that you can have access to hundreds of advocates who are literally excited to pick up your chat and chat with you about anything that you need in those moments, right? So that's the number one reason why people come to Poppy. But the number two reason people come to Poppy is for our evidence-based library, which is actually free to everyone who downloads the app. So you have full access to this library. It's a collection of fully vetted articles. We are doing some really fun things with that library this year, actually, but like very specifically, our advocates love the articles. You'll love the articles. We also know 75% of everyone that comes to Poppy Seed Health, they're going to the evidence-based library. And they're doing that because we're all sleuthing for information that we trust, right? And that we don't have to go a million places for. So that's really important to us. And then lastly, and this is more, I think it's really critical to kind of the magic that happens behind the scenes. So when someone pushes that request chat button, this seems so simple, but what's actually happening is that our powerful matching algorithms are working off of information you've shared with us when you signed up, just 10 very simple questions. So if you're pregnant, you're only going to be connected with an advocate who can support you during your pregnancy. Same thing with postpartum, same thing with loss. And it's these matching algorithms that we are so proud of because they're going to get way more granular. They are connected to our advocate network, which spans the entire country, every single time zone. 50% of our advocate network identify as BIPOC, 30% identify as queer. We have a lot of other intersectionalities. And so that's really important because we want to meet people exactly where they are and really understand how to support people through whatever their acute need is, but also in matching them with their own intersectionalities as well.
Gotcha.
And that's really important for us at Poppy.
Okay. So a couple questions. What kind of content is in your evidence-based library? And then why do you specifically offer doulas, nurses, and midwives? And then I guess added to that, why not physicians also?
Yeah. So in our evidence-based library, we have categories, and all of those different categories, to be illustrative, are from, lactation support and feeding in your feeding journey to things like lightning crotch, right? Things no one ever tells you to,
right.
Hemorrhoids, which by the way, for a long time was in our top 5 categories because no one talks about it.
Right.
To partner support and the best gear that you need, the only gear that you actually need for a newborn. We think we need so much, but we don't need that much. And things like that. And when we say evidence-based, we mean that they are grounded in fact, in truth, and in data. That's very important compared to, I always say, you can go down a million different rabbit holes on the internet, especially when you're pregnant. And then all of a sudden, 5 hours later, you poke your head up and you think you're having a dragon with 5 heads and 3 toes, right?
Right. 100%.
So evidence-based information is really important.
Got it.
And I'm sorry, what was the second?
Oh, yeah. Sorry. So the second question is why and they were totally unrelated. I don't know why I said them together, but I did.
Okay, that's fine.
The second question is, why do you specifically offer doulas, nurses, and midwives? And then I guess added to that, why not physicians also?
Sure. Okay. So we started with doulas, midwives, and nurses because so many people don't realize this, but when we talk about advocates and what that means for you, for your emotional health, your mental health, and your well-being, those are your advocates that are already established in maternal health care. So doulas for so long, they're trending now. So we're hearing so much about doulas, but doulas have been around really since the beginning of time, supporting women through their birthing experience, through their pregnancy. And I think even more explicitly to explain a doula is someone who will not only be, as I say, your kind of best friend through your journey, but it's also one of your most intimate partners. So I'm a doula myself, right? And when I became a doula, it was before Poppy Seed Health, very specifically because I really wanted to be boots on the ground, supporting clients who have the best health insurance in the world and supporting clients who are on Medicaid or had no health insurance. And it didn't matter who I was supporting. There were these human-centered emotional needs that only I could really support them with as a doula, right? And it's because we focus so much on making sure that you don't feel this shame and stigma, but also providing you with tools to feel empowered, to own your own journey, own your own experience, and more importantly, to be able to communicate with your providers, with your family and friends, and just have a conversation with yourself about what you are capable of and how incredible it is to be going through your journey, whatever that actually looks like.
Sure.
And then midwives are medical professionals, right? They're medical providers. Doulas cannot catch your baby. They're not doing any medical exams. They're not doing any of that. But midwives they take a more holistic view as it relates to your pregnancy needs and deliver the baby. And nurses in a hospital setting, especially, are your advocates. There are so many people who, especially after having their first baby, will say, "Oh my gosh, I had no idea that I would be with my nurse the whole time."
Right.
And there are amazing and wonderful providers out there to answer that question of why we don't currently have providers. We really wanted to ground in that emotional and wellness support that is missing from our maternal healthcare journey today in a holistic way. So what happens between those 20-minute appointments when you're pregnant, for example, when you're home alone at 3 a.m. in the morning and you have the most tender breasts in all of the world, right? Like, where are you going? Who are you asking? Where are you going for support? When you're going through a pregnancy loss or you've just experienced a pregnancy loss and you need someone to talk to that's not all medical, right? That isn't, a part of the journey today. I often say that our providers can be really wonderful, but our providers can also be dinosaurs at times. And it's in so many ways not their fault, because so much of what is happening on the medical side is based on billing and not necessarily based on what your provider would love to do.
Mm-hmm.
Plenty of doctors that would love to sit down and actually comfort someone for an hour, but they can't. And they don't necessarily have that kind of training, right? So
100%. Yeah.
we absolutely wanted to start with that emotional support that is completely missing from the maternal health care journey today. But that's not to say that in the future we wouldn't think about where providers fit into the matrix of Poppy Seed Health. We are actually the perfect supplemental partner to providers.
100% for sure.
That we can support your patients in ways that you would really like to, but you're just not able to.
Yep.
And I think we know, especially for communities where mental health and emotional support is already stigmatized, having a secure, trusted place to go and having your doctor, recommend somewhere really has an impact on that person and their health outcomes, right? So that's why we focus on doulas, midwives, and nurses today.
Yep, totally makes sense. But they're not offering medical advice, to be clear.
Absolutely not. As a matter of fact, one of the, so we have a really rigorous onboarding for all of our nurses, our doulas, and midwives. They are all certified, trained, and or licensed. And then, so that's on their own. And then they come to Poppy and they go through our own rigorous onboarding. So I always say, by the time someone picks up a chat in Poppy Seed Health, they have gone through a few months of being with Poppy before they're even able to accept their first chat. We take that really seriously because where we really shine is in those most vulnerable moments with people. Believe me, they're not coming to Poppy Seed Health and talking about the weather. They're coming to Poppy and immediately like, hi, my name is Simmone. I have no idea what to do about these cracked nipples, right? Or whatever it is. And they're really getting into it. So we very much know that we may be the only place that folks are coming in those moments. And a lot of the reason is because they, like me, went onto the internet looking for something or somewhere to go. And so anyway, we make it really rigorous. And we also think that it's extremely important for every single one of our advocates who already know from their training when someone is asking for medical advice and when they are not.
Gotcha.
And the best thing that we do at Poppy in those moments when someone is asking for medical advice, which by the way is actually very rare when they do, is we are able to help them craft the conversation or the question they need to have with their provider.
Yep.
There's also a lot of medical trauma that happens, and we are getting those folks who are coming to us and saying, with my last pregnancy, I really didn't like my doctor. They never listened to me. They, ignored everything that I had to say, and I just felt so disempowered. Well, we're there to help them craft, right? To see them and understand where they're coming from, but to also help them craft the kinds of conversations they can have to help them be empowered and help them to advocate for themselves, which is, so important.
Sure. Now, do people talk to the same person like once you connect with someone, do you stay with that person, or is it different people whenever you connect?
Yeah, I'm so glad that you asked that question, because I will tell you, so before we actually launched out into the world, Poppy will be officially 1 year old next week. But before we actually wrote one line of code, it was really important for us to get as close to a customer as possible and as close to our members and really understand what the behavior would be like, because with a revolutionary, innovative product like Poppy that's changing consumer behavior, I have a product first point of view, which is, instead of building something and thinking everyone's going to love it, go to the people first, see what they want, and
Right.
then figure out what works in behavior. So,
Right.
so we tested this. We were in beta for nearly a year before we wrote one line of code, and it was very interesting seeing the behavior. People didn't actually care who they were talking to. What they cared about was how quickly and expeditiously we could respond, and also the information and the kind of support, right? So, we really have three principles at Poppy. That's support, educate, and advocate, right? So the support, we realized it didn't matter if it was a different person every time, because, kind of going back to this metaphor of having a different driver every time you get in the car, they really just expected the same level of support that they were getting from any Poppy advocate. So not building a relationship with one person was very clear to us, but building a relationship with Poppy Seed Health
Gotcha.
was what mostly everyone wanted. And so that's the product that we have today. So every time you request a chat, you are going to get one of our trusted Poppy Seed Health advocates. And we also found in our surveys, which was very interesting to note, is that some people really do want different opinions, and not like they're looking for a specific answer, but they are very interested to have a conversation with someone different each time, because it actually helps them, make whatever decisions they need for themselves. It makes them feel more supported. It makes them feel like they really, truly do have a team that they can depend on, and, we're right in their pocket. On the other hand, there is certainly behavior that has happened in the last year that we've seen where people actually do want to have the same person, but it's not the same person. It's more like the same team. And so we do have some of those features coming that we're starting to test now, which is going to be very, very interesting for us to see what happens when people have the same team, and not necessarily for their entire, pregnancy or postpartum or membership with Poppy, but for those episodes, right? So clearly, your first trimester is different than your third trimester, which is different than your fourth trimester, right? And so
100%, yeah.
We have different teams, or let's say different mapping of teams, right? In your first trimester, maybe, you actually want you want primarily doulas and a midwife. But in your third trimester, when you're getting ready to go through your birthing experience, a labor and delivery nurse makes sense. A postpartum doula makes sense for you. Maybe a feeding and lactation person makes sense. So that dynamic kind of team, and also the matching algorithms, are something that we are very deeply focused on for improving how people experience Poppy and have access, is really important.
Gotcha. And speaking of access, what is the cost?
Yeah. So I always get really proud when I talk about the cost. I'm a little bit like a peacock showing off my feathers when I talk about the business model for Poppy, and that is because the cost is $29 a month. That's a monthly subscription that gets you access to 24/7, 365 support from our advocates, also access to the evidence-based library. And we also actually introduced a $5 chat a few months ago, because there are some people that just want to try the product without that monthly subscription, and we get that. And so that $5 price point gets you a 30-minute chat.
Okay.
But before I hired one person at Poppy Seed Health, I created a business model to boldly center equity and access. And so we actually support people on Medicaid, and who are also in overlooked and underserved communities. Very specifically, that means that we take a dollar amount, which is $2 today, from every paying customer, and we're able to support someone who is on Medicaid. Poppy Seed Health is currently not covered by health insurance, and that is because doulas are not covered by health insurance. But with that being said, very early on, I did start having conversations with insurance companies and payers, which is actually a critical piece here for us in terms of equity and accessibility and scale, right? But to put that in perspective, 50% of all births in the US are Medicaid, which means that we have 50% of the birthing population that don't have the same equitable access to care and good quality care. And for us, that was, I mean, for me personally, that is just unacceptable. And so we built Poppy to be able to support folks on Medicaid, which means we have the kinds of advocates that can also do that. So today I'm really proud to say, just shy of our 1-year birthday, we have supported just over 30% of everyone who comes to Poppy Seed Health are on Medicaid. And that's important for me to share because you can afford $29 a month, whether it's for you or you want to gift Poppy Seed Health to someone. Just know that we're doing that equity work for you. And we, that's our Poppy promise. That's really important for us. I think personally think it's important that this is not just, doing good for the world. It is. But we have a maternal health care crisis in this country. And it does not have to be that way, right? We are the only developed country where our mortality and morbidity rates are on the rise instead of on the decline. We know that having culturally competent care providers and also information is incredibly important for health outcomes for folks. And the last thing here I think is really important is so I'm a Black woman. I am a founder of a health tech company. So it's so interesting because everyone presupposes that I'm only building for Black people.
Oh my God, Simmone. Girl, you are telling my story because like I say this, I am an expert in pregnancy and birth, period. Yes, we focus on, of course, we care about Black mamas. Of course, Of course, we have that knowledge and we have that expertise, but Black people can be experts in things, period. So that's my little soapbox. Sorry.
Absolutely. No, I'm so happy that fired you up because people presuppose that I'm only building for Black folk, and I am not, but I am very boldly centering where our maternal health care crisis is. And it's for women who look just like me, who identify just like me, and my own lived experience. I wish I could say for a long time, I carried a lot of shame around this, but I actually, during this period, so between 2016 to today, I've been on the roller coaster of having access to good care because I had the best health insurance when I had my first pregnancy loss. And then I had no health insurance, and I experienced what it looked like to be on Medicaid myself when I had my second loss. And then I had marketplace health insurance when I was trying to figure out what exactly was happening with, this beautiful uterus of mine, and could not get to any of the specialists that I needed. And then back to, the Cadillac of great health insurance. My point is that I have experienced firsthand what it means to have access to good care and what it means to have access to terrible, crippling care. And so Poppy Seed Health, we center equity, we center accessibility very much. That does not mean in any way that and that anyone should presuppose that people who are on Medicaid are all people of color. That is not true.
They're not. Yeah.
They absolutely are not. It does not presuppose.
Majority are not, actually.
Exactly. It does not presuppose that people who don't have access to care do not deserve access and equitable care. And so, Poppy is here to give that kind of support to everyone. And like I said, if you're able to afford the $29 a month, and you will love Poppy, I promise. But whether or not you're thinking about it in the moment, we are automatically doing that equity work for you.
Gotcha. Well, as we wrap up, just a couple more quick questions. One, can partners participate too? Is it just for the pregnant person?
Oh, are you looking at our roadmap? It's we're fly on the wall in all of our product and tech meetings. So actually, one of the things I'll tell you now, I guess, Dr. Nicole, you'll get the exclusive here. From the day that we launched, which was April 27th, 2021, one of our first members to join was a partner.
Okay.
Not the person who is carrying, right?
Gotcha.
And I knew some of this would happen, but I don't think that we really realized how many partners would find themselves at Poppy Seed Health, which is not surprising, because if we know anything, especially today in 2022, about what it means for people to feel emotionally supported, to have the kind of access to family support and their provider support, and having doulas, midwives, and nurses like at Poppy support you, is that it is a family affair.
Mm-hmm.
It is not just about the birthing person. It truly is a ripple effect through the family. And so we have partner support that is coming to Poppy, because not only do we see the behavior, so we know that people want it, but we know the data shows that partners have their own experiences, their own emotional needs while they're going through their own journey with their partner. And in addition to that, we want to set them up for success for actually supporting their partner, right?
Gotcha.
Supporting themselves and supporting the partner. And it's not like a group chat or anything like that. It truly is a very different productized experience for partners. Now, with that being said, have had some feedback of, well, the mom doesn't even have enough support to begin with. Why are you now building with partners? Well, we see a really big divide there, actually. We do think that there could be better support if there's partners. And the other thing that I'll say, without giving too much away, but that is, anyone can be your partner. It doesn't have to just be the person you made the baby with. If that's how your family looks, right? We know the modern family looks very different today. You could be wherever you are in your family making process, and whoever you are, whether you were queer or in a more traditional family setting, or adopting, or you have a gestational surrogate, whatever that looks like, we want to support you at Poppy, and we can support you at Poppy. But that partner could be a grandmother, it could be an aunt, it could be a dear friend, right? Whoever your birth partner is, they also have their own needs and support, and they really do want to. Most times, they really, really want to know how to best support their partner through their journey.
Gotcha.
So coming soon, I'll just say.
Gotcha. Well, as we wrap up, what is your favorite piece of advice that you would give to expectant moms or families?
So my favorite piece of advice that I like to give to expectant moms and families is that this is the time for you to not deny any help. This is the time to ask for help.
Yes.
This is the time to ask for support. This is the time to take the support that you feel that you need, and even sometimes that you don't even know that you need yet. So I have a saying, which is this. So we're talking about expectant moms and families, but I also, for all of those listeners who have had a baby or a newborn, you can tell everyone with great confidence, I'm sure, that the thing that you didn't need was flowers. What you needed, or maybe
Yes.
even perhaps another onesie for the baby or another cute outfit, right?
Yes. Yes.
So this advice is for all of the supporters and all of the people who say, well, what can I do for this person who's just had a baby, who's trying to get pregnant, do not send them flowers. What you do is you show up to lend a hand or bring a lasagna or do both.
There you go.
Offer to, if there are other kids in the family, offer to babysit for a couple of hours. So, mom and dad or whoever can go off and have a nap or a shower, show up with dinner, send dinner. Lately, in this day and age, I've actually been sending digital gift cards to their favorite food delivery, place. These things really matter. The meal trains are a thing. It used to be that everyone in the neighborhood or in the village knew when someone had a baby, and there was no question that family was fed for months.
Yep.
And so, lend a hand or a lasagna, but be helpful because they won't always ask. Do a load of laundry, bring laundry detergent. Like, I don't care if your friends are living in, mansions in Beverly Hills, or if your friends are experiencing housing insecurity, everyone needs this kind of support. So that's my sage advice for all the expectant moms and families out there. Don't be afraid to ask for help.
Love it. Love it. So where can people find you?
So they can find Poppy Seed Health in the App Store on Apple or Google Play for Android. You can also follow us on Instagram, and that's just at Poppy Seed Health. And we're also on Twitter and Facebook. What else am I supposed to say?
Nope, that's it. That's it. We'll link. Okay. Yeah, we'll link it all up in the show notes. Well, thank you so much, Simmone, for agreeing to come on. This was a really great conversation. I love what you're doing, and just thank you for sharing all of the great stuff in this episode today.
Thanks so much for having me, Dr. Nicole.
Wasn't that a great conversation? As you can see, she is super passionate about her work, and I really enjoyed hearing her story and hearing how she created this great app. Now, after every episode, when I have a guest on, I do something called Dr. Nicole's Notes, where I talk about my top 3 or 4 takeaways from the conversation. Now, before I get into Dr. Nicole's Notes, let me tell you something important about this week's podcast episode sponsor, Ellement. I had the pleasure of chatting with the founder of Ellement, and let me tell you, she is so incredibly passionate about this and takes a very serious approach to creating a wonderful prenatal supplement. Ellement provides a tailored prenatal supplement for each person, whether you have certain dietary preferences, a high-risk pregnancy, nutritional deficiencies like low iron or vitamin D levels. And every 30 days, they can adjust your prenatal protocol to make sure it is the perfect fit for you throughout your pregnancy journey. Ellement has exceptional ingredient quality with no fillers or additives, and the packaging is eco-friendly too. So visit helloelement.com. That's Ellement with 2 L's. HELLOELLEMENT.com. Go ahead to their website and join the waitlist today. All right. So for Dr. Nicole's Notes, first one is I want to acknowledge that we OBGYNs have some work to do in the way we treat women who have a miscarriage. That was obviously a completely unacceptable experience that Simmone had. But I want to be honest and say, I don't think I've ever done something to that degree. But there certainly has not always been a recognition of the difficulties that some women have with miscarriage. For OBGYNs, it's very common that we see miscarriage. So unfortunately, sometimes I think because we see that it's common, we don't necessarily recognize the impact and recognize that people can connect with their pregnancies very early, and a loss, even if it is early in the process, can be really, really devastating. So we as OBGYNs have some work to do in how we treat women who have a miscarriage. And then in society, also just some work on removing any shame, removing any guilt, acknowledging the loss, and feeling comfortable talking about it. All right. Point number 2 is I want to emphasize that it really can be a mixed bag of feelings in regards to getting pregnant, in regards to pregnancy, in regards to motherhood. You can have ups and downs from being excited to being, ambivalent to even being angry. None of those things, none of that up and down, none of those differences in emotions are bad. None of those differences are abnormal or problematic. In fact, they just mean that you are a normal human being. So expect that in regards to your pregnancy, in regards to motherhood, if you have those waves of emotion, it doesn't mean that you're not thankful, doesn't mean that you're not appreciative. It just means that you're normal. And then the final thing I want to say is ask for help and support. Just ask for help and support. That's something that I want to reiterate. We in our U.S. hustle culture, individualism, do everything, strong, powerful, blah, 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 blah. Sometimes there's this backlash or this, you don't feel comfortable asking for help or support. You feel this pressure to kind of do everything yourself. Please ask for help, accept support, be clear with the help that you need. There's nothing wrong with that at all. And speaking of help, I have created something new that I'll be talking about very shortly. I am so excited to tell you about it. If you love the podcast, you are going to love this new thing I created. So be sure to listen. Don't miss an episode because it's only going to be a limited time that you can access this new product. So listen to the podcast or join my email list at drnicolerankins.com/email so you will be sure to get announcements about that coming up. Okay, so there you have it. Do me a solid. Share this podcast with a friend if you love it. That is how this show grows. That is how I can reach and serve as many pregnant women as possible. That is my heart, soul, and passion, and I would love your help in doing that work. Be sure to subscribe to the podcast in Apple Podcast or wherever you listen to podcasts. And if you feel so inclined, I'd appreciate you leaving an honest review in Apple Podcast. I love to hear what you think about the show. And another place we can connect outside of the show is Instagram. Hop on over to Instagram, follow me there, drnicolerankins.com. I provide lots of great information about pregnancy and birth, and be sure to turn on notifications for my posts so you don't miss a thing. So that's it for this episode. Do come on back next week and remember that you deserve a beautiful pregnancy and birth.